Good afternoon and thank you for joining us. My name is Tina Tebow and I will be your moderator for this afternoon's news conference. Joining us today, the Honourable Stephen McNeil, Premier of the Province of Nova Scotia, and Dr. Robert Strang, Chief Medical Officer of Health for Nova Scotia. Go ahead, Premier.
Thank you, Tina. Good afternoon. COVID continues to take lives in our province. And today I'm sad to say that we've lost two more of our seniors at Northwood. And this doesn't get any easier. And to the families, I'm sorry. And to everyone with family members in Northwood, I want you to know that we are doing our best to get this virus under control. COVID is also having an impact on families of those who died over the weekend's tragedy. This is a difficult time to mourn together physically with distancing protocols in place. Our hearts are with you. And before I turn it over to Dr. Strang, I want to let people know we will be waiving extra dispensing fees for those enrolled in family pharmacare and senior pharmacare. This will help keep a little more money in the pockets while they are protecting the drug supply to ensure that during COVID, Nova Scotians can get medications they need. Dr. Strang will give you now an update on the COVID today.
Thank you, Premier. Yes, we unfortunately have to announce two additional deaths due to COVID-19. Both are in residents of Northwood. And like the Premier, I want to give my condolences and deep sympathies to the families who have lost loved ones. It is tragic, and we just have to move forward. We now have a total of 12 Nova Scotians who have died as a result of COVID. And I think we all need to pause and just, this is why we're doing what we're doing, and we're having the restrictive measures that, and please use this as a signal to understand and remember and remind yourself of how serious COVID is and the or can be, and why we all have to continue to do what we're asking you to do, what you've been ordered to do under the public health order to protect each other. We now have a total. We have 35 new cases of COVID today, bringing the total number of confirmed cases to 772. We currently have 10 individuals in hospital. 3 of those are in the ICU. We have now 330 people that have recovered from their infection, and we can consider them to be resolved. We have tested 22,993 Nova Scotians who have had negative test results. And we have 10 long-term care facilities and unlicensed seniors' homes that have cases of COVID-19. In total, we have 148 residents and 65 staff. I want to come back to the testing. It's really important that we continue to test people as a key part of our strategy. We are testing more Nova Scotians per capita than any other province in the country. That's thanks to a range of people in the healthcare system, in our lab and an 811 and the assessment centers, to providing the capacity to do that. It's also thanks to Nova Scotians for recognizing the need for COVID testing and coming forward as appropriate. And I want to remind Nova Scotians that we have anybody, no matter whether you've traveled or not, no matter what part of the province you're in, if you have symptoms that could be COVID-19, that we want you to come forward and get tested. So if you have fever, 2 or more of fever, new or worsening cough, headache, sore throat, or runny nose, if you have 2 or more of those symptoms, if you're able to and have the online access, go to the online 811 assessment tool and then follow the directions as you go through that tool. If you do not have the online capacity, you can call 811 and they'll then do an assessment with you through their telehealth line. And either direction, whether it's online or through the telehealth line, if you're necessary, you'll be directed to an assessment center and be tested. And we have no challenges. We have very short wait times for 811, short wait times to get directed in to be tested. As we continue to process this last weekend's unspeakable tragedy, I know many people continue to look for ways to show their support and respect to the RCMP, to other police forces and first responders, as well as to the families and loved ones of the victims. However, we are also dealing with COVID-19, so I'm renewing my call to ask Nova Scotians to please find ways to show your love, your respect, your support in a virtual manner, to do this safely so we do not allow COVID-19 a further chance to get a foothold in our province. We know people want to and are I've seen people organizing, gathering along the roads or outside detachments. We have reports of people actually approaching police officers that would, in normal times, would be very welcome gestures of handshakes or even hugs, getting a photo together. Some people are offering bringing food to our RCMP detachment in Truro where people are working from. Unfortunately, it's terrible that I have to say this, but please, we need you to not do those things. We will get a time in the future where we can have these more direct contacts, but now we ask people to respect the rules around social distancing, around staying apart from each other. We know that RCMP, other police, they're working long hours. They are being provided necessary food and water, etc. And while we appreciate those gestures, at this time we ask people to not do that. There are other ways that we can all show our solidarity and our caring. The province has set up an online book of condolences. I would encourage people to go there, novascotia.ca/condolences. The RCMP has also set up a memoriam website for Constable Heidi Stevenson. So I'd encourage people to, if they're so inclined, to go to the RCMP website and look for that. We know that in this province and across the country that people are rallying around the victims of this horrendous event. I'm sure that they feel the love and support, and I would ask people to continue to do that in virtual ways, ways that can all keep us safe.
Thank you, Dr. Strang, and Tina will now take questions.
We'll now go to the phone lines for questions. Again, as a reminder, we will take one question and one follow-up from reporters in the allotted time that we have. We'll start with Mike Gorman from CBC. Go ahead, Mike.
Thank you. Dr. Strang, for the third day in a row, we have seen the number of recovered cases outnumber the number of new cases. What we're also seeing is that the majority of the new cases in the last few days have all been related to long-term care homes. And I'm not trying to diminish the effect of what's happening on long-term care homes, but I wonder what those statistics, along with our low hospitalization rate throughout this period, says about the course the disease is taking at this point in Nova Scotia.
So it tells us potentially good news, and I want to frame my answer to saying we're still very early on, and that we cannot use this as a way to say, okay, we can kind of ease up on our restrictions. It's premature to do that yet. However, what we are seeing is that indications of a decrease in community transmission in Nova Scotia. In many parts of Nova Scotia, we continue to have only sporadic cases. In the HRM area, we have areas of more robust community transmission, especially in the Dartmouth side of the harbour. But that appears to be decreasing. But that's very early on. And if anybody thinks that we can ease up now, they're mistaken. Because if we start to ease up now, we know that the large majority of the population is still not immune, has not been exposed, and we will give COVID-19 a foothold to come back and resurge even within our communities. We are still seeing challenges in our long-term care facilities, and this is happening across the country, where we're seeing, because of the frailty frailty and the underlying health status and the age of our long-term care residents, they are highly vulnerable to severe disease and dying. And unfortunately, that is what we're seeing in Northwood. We're seeing it in other parts of the country. So I keep coming back to what we're needing to do to control COVID is not just about keeping ourselves safe. It's about doing the things as difficult and as restrictive as they are. They're necessary to minimize the ability for COVID-19 to spread in our communities. And a key piece of why we're doing that is those in our communities and in residences like long-term care facilities who are much more vulnerable and at risk for severe disease and dying. They need the rest of us to do what we can do to minimize spread in our communities so they can be safe. We can minimize the chance of a healthcare worker unknowingly taking COVID-19 into a long-term care facility. So yes, some early signals of perhaps some good news, but we absolutely have to stay restrictive for the next few weeks. We are carefully looking as our epidemiology evolves over the next few weeks, and we're involved in national conversations in public health about how we might start to think about loosening restrictions. But again, it's far too soon to actually be taking action in those areas.
Go ahead, Mike, with your follow-up.
Thank you. Premier, the NSGEU put out a news release today, which I suspect you're aware of by now, expressing concern about working conditions at Northwood. And they're saying that at a time when hospital staff are being pulled in to help with the crisis there, they are being confronted by a situation where there's not enough PPE, there's no infection control, residents are being able to move around freely, unlike the way they would in the hospital. And they're expressing concern that this is opening up healthcare workers to getting infected. What concrete measures and guarantees is your government taking to make sure that these healthcare workers who are being pulled in to work here are being protected?
I've been in conversation with folks in the department and in Northwood today. We certainly recognize that the middle of last week, things got to a significant challenges within Northwood, and they needed help, and they reached out for help. Over the weekend, significant help has been brought to them, bringing in teams from the Nova Scotia Health Authority, from other parts of the healthcare system. We recognize that there's still some ongoing challenges with staffing, and those are being worked at as quickly as we can. We've asked the unions to be part of this. I had a phone call with unions on Monday. They were raising some of these concerns. I asked them to bring those concerns forward where there were legitimate concerns, bring them forward within the facility. There is an incident management structure that any concerns can be brought forward through to be appropriately addressed, and we continue to address legitimate concerns. I had a conversation with an infection control practitioner from the Health Authority who's on the front lines right now in Northwood today. I've worked with her for over 15 years. I completely trust her judgment. She said there is no validity to the concerns that the NSGU is raising around infection control. I really question, and I'm very concerned about the way the NSGU has taken their concerns publicly. They're using, frankly, fear-mongering and hyperbole in terms of the way they're describing this situation. When we talk to frontline people who are in Northwood, what the NSGU is saying is actually inaccurate. So I challenge the NSGU to not scare people unnecessarily. They're creating fear and anxiety where it's not necessary, and that's inappropriate. Come to the table and work with the rest of your unions, the rest of the healthcare system to help Nova Scotians. Don't be out there doing whatever you're doing, which I don't understand, for yourself, please.
Next, we'll go to Natasha Pace from CTV.
Thank you. I just want to clarify first, how many of today's cases are from Northwood?
So we have a bit of a challenge because the time frame of reporting is different for how we collect them for the total provincial numbers. But we know yesterday there was 20 of the new cases reported from Northwood in residents, and there were another, I believe, 3 of staff. A few of those may have been reported in our provincial numbers yesterday, but the majority would be in our new cases that we're presenting today. So certainly there's a significant proportion of our cases right now that are coming from the Northwood outbreak.
Go ahead with your follow-up, Natasha.
Thank you. I've been speaking to families who have loved ones in Northwood for a bit now, and again, the issue is raised that there's multiple residents sharing a room. And I spoke to a woman today who said her father shares a room with 2 other individuals. One tested positive for COVID. The other 2 individuals had to still stay in that same room with him. And now her father has tested positive for COVID-19 as well. Why is this happening? Why are residents who test positive still being kept in the same room as residents who have not tested positive? Is there some kind of protocol there or something that needs to change?
No, it's simply a fact of we're recognize that issue. I know Northwood, with the supports they're getting, is doing as quickly as they can to resolve all those situations. It's simply a matter of the space within the facility to move as many people around as possible. As we move more of the recovered people out of Northwood and into the hotel environment, we will have more capacity. And in my discussions with Northwood, I talked with Josie Ryan last night. They are reducing the number of people in those situations as quickly as and end that as quickly as they're able to, as the flexibility comes to them as we bring take the recovered residents out of that facility. Even when we have those situations, as not ideal, but what steps can be taken to minimize contact, minimize spread, even within rooms, is being taken.
Next, we'll go to Keith Doucette from the Canadian Press. Go ahead, Keith.
Yes, good afternoon, Premier. I'm wondering, the U.S. consulate in Halifax issued an email alert to U.S. citizens on Sunday about an active shooter based on the Nova Scotia RCMP's Twitter feed. Why was the province waiting for official word from the Mounties before issuing an emergency alert?
Well, that's the protocol in place when it comes to EMO. As you know, the emergency alert, the lead agency is the one that has to put the message together. We would not go from what's happening by Twitter. We would need the lead agency to actually craft the message so that we could put that out, and no message was received, even though EMO had reached out a number of times throughout the morning to the RCMP.
Go ahead, Keith, with your follow-up.
Yeah, I think I'll stick with that. Why did you have EMO staff in anyway? It appears like you were anticipating that something was needed, and then nothing happened. Is that a question for you that you're wondering about?
So we would have that command center would have been going around COVID. So as we stood that up early on, EMO put that up. Though through a number of things that we were seeing on, or the EMO staff were seeing on Twitter, they called in the support staff around the alert message team, and then began to reach out to the RCMP, who would have to craft the message or work with our team to craft that message, and no message was received.
Next, we'll go to Alicia Dreas from Global. Go ahead, Alicia.
Hi, good afternoon. I'm just wondering about, in terms of long-term care, federal guidelines are recommending that long-term care staff do not move around, and there are some calls to have that actually officially mandated. I'm just wondering, as we continue to see more positive cases and deaths in long-term care, I mean, is it time that we prevent staff from working in multiple settings?
So within the health system, we're looking at the assessment of what the impacts of that, what it would actually do. We know that there are critical staffing issues that could result from mandating people work only in one facility. But there is an assessment going on, and to say how close could we move in that direction and what would be the impacts of that. We do know we already have some things in place through our long-term care directive. So if a facility is an outbreak situation, we are asking that staff only work within that facility, and we're taking steps that would minimize the need to bring in staff from other facilities by allowing under very strict protocols, for instance, workers who have been identified as a close contact, but we test them, and if they're negative, they can come back to work under strict protocols. All of that it's an example of the things we're doing to keep workers who are in a facility, working within a facility, minimize the chance to or the need to bring in outside help.
Go ahead, Alicia, with your follow-up.
Yeah, just kind of wanted to follow up on the claims from the NSGU. I know that you said that they were unfounded. Now, I've spoken with others at the facility who have kind of raised similar concerns in that people aren't practicing social distancing measures. And, I mean, we're not allowing visitors, but some people are still allowed into the building to bring items to those who are, I guess, renting units there. And so I'm just kind of wondering how often inspections are happening to ensure that all the protocols are being followed.
So we have to understand that there's three types of I guess, living arrangements in that whole Northwood complex. There is the long-term care facility beds where the outbreak is happening. There are also people who have some need of what we call assisted living, and then there are people who are independent living. I've been assured by Northwood that the people who are in assisted living and independent living, they are separated from the long-term care facility part, and there is no movement of people. There is no movement of either residents or staff. So there's not the virus is not able to could not be transmitted from the long-term care facility into those other two types of living arrangements. Certainly the people independent living, they have their own tower, they have their own entrance. They can come and go as other people in that community, and so that may be confusing to people because they see people going in and out of Northwood, but that's a completely separate entrance. It's a different part of that whole campus, if you will, that is separated from the long-term care facility where the outbreak is happening.
Next, we'll go to Paul Legere, Radio-Canada.
Yes, my question is for the Premier. There was a nurse from the Halifax Infirmary who was questioning whether there might be problems with staffing at the Halifax Infirmary if they were to go to the Northwood Manor, and was bringing up the what was done in Quebec with some long-term care facilities where healthcare workers from the military were called in. Is that a possibility here? And if not, might it be a possibility in the future?
I was asked that question yesterday. I mean, it's certainly not off the table. We know that if we need to, we could make that same request too. But at this point in time, there's no indication from the teams that are on the ground with Northwood, the support they're getting now from a number of places, other partners in the long-term care sector, Nova Scotia Health Authority. We even have students in there from the Nova Scotia Community College Continuing Care Assistance Program. They certainly feel, while there are some staffing challenges still that they're actively working to resolve, there's no indication at this point in time that we need to make a request of the military. But again, we recognize that option is there if necessary.
Go ahead, Paul, with your follow-up.
That's a follow-up question for Dr. Strang. I'm just wondering, what would be the one main reason that the situation at Northwood Manor happened more than in other long-term care facilities?
So my understanding of the outbreak, talking to my medical officer of health, who's kind of leading the public health parts of this and working closely with Northwood around the epidemiology, as well as my conversation with the director at that facility, they were unfortunately the belief is that there were about 3 weeks ago, there were multiple times that the COVID virus was brought in unknowingly unknowingly by a number of healthcare workers, and that just by bad luck, some of the situations were individuals whose job they were moving throughout the facility in different ways, because that was part of their work to do that. Whereas many of the healthcare workers they work on a single unit or a single floor, but some people move around, and it was unfortunate that we had people who, as part of their job, were doing that. Therefore, the virus was, before it was even detected, the virus had been widely spread throughout the facility. And once that happens, we can apply all the infection control and other supports, but it becomes very difficult to manage. And that is why we ended up in the situation last week. And if you look at the 1 to 2 week incubation period, it took that time, and then all of a sudden there was a surge of a large number of residents coming down ill. And that is the reality we're faced with now. And that Northwood was put under extreme pressure, and they're now getting the necessary supports from the rest of the health system.
Next, we'll go to John McPhee from the Chronicle Herald. Go ahead, John.
Thank you. This is for Dr. Strang. Do we know if the toll in a large nursing home like Northwood during a severe flu season, and we've seen dozens of deaths in some years compared to the 12 deaths so far during COVID, would it be comparable to what we're seeing with COVID in terms of the percentage of deaths in a large complex?
So I'd have to go back and do, pull out a whole bunch of numbers to answer your question in detail. But off the top of my head, we have influenza outbreaks in long-term care facilities every year. How many and the severity depends on the strain of influenza. But I have never had an influenza outbreak to come anywhere close to what we're seeing right now in Northwood with their COVID-19.
Go ahead, John, with your follow-up.
Thank you. This is again for Dr. Strang. You said previously that the peak of the pandemic, this was, I think, a couple of weeks ago, would occur at the end of this month. You just said we're still very early on in the pandemic. I realize this is an evolving situation, but can you clarify when the worst of this will be over?
So if you go back to my remarks, I never said with any certainty where we might see things. I said based on what we're seeing in other parts of the world, other parts of Canada, we can anticipate that it might be likely towards the end of April that we could see the peak. But there's all sorts of, uncertainties around that. What we may be seeing, and to answer to an earlier question today, some very early indications that we might be past the peak to us in community spread, which is what other provinces are seeing. However, they still have substantive concerns around residential care situations like long-term care facilities. We have outbreaks in correctional facilities in other parts of the country, in shelters, anywhere where people live together. So my point is that even if we are slightly past the peak, and it'll take a bit of time to be really more definitive on that, it's still way too early to talk about loosening up restrictions for the reasons I outlined earlier. We still have a lot of people that are not immune, and if we loosen up too early, the virus will, make no mistake, the virus will come back with a resurgence, and we're back where we were. We're back at the very beginning again.
Next, we'll go to Lindsay Armstrong from All Nova Scotia. Go ahead, Lindsay.
Thank you. For the Premier, you announced the Small Business Impact Grant on the Worker Emergency Bridge Fund on April 2nd. When did Nova Scotians begin to receive assistance from these programs, and are you satisfied that people received money when they needed it?
Well, they are receiving it now. In some cases, I believe there are some applications, depending on when they came in, are being either verified or just making sure they qualify, but there has been money that has been going out in this program really about 6-7 days after we announced it, money started flowing.
Go ahead with your follow-up, Lindsay.
So I reiterate that, are you satisfied with the speed at which this happened? And then what is the province planning to do with the remaining $5 million in the fund administered by Dalhousie? And who is actually involved in the planning work for allocating this money? Who is a part of that group?
So if you look at, we set aside the money in with Dalhousie and the Red Cross as part of that. The Red Cross is doing the supporting us through the emergency bridge funding program. The Red Cross, or sorry, the Dalhousie would have been working with some of its students, not only their campus. My understanding is they reached out to their sister campuses to assess the financials. So they've been using students from their financial department, business, and all of that to assess and verify, and then that was the online portion. That money would be going out. There was the rents up, or rent deferral was part of that money as well. And then we're just looking at the needs as we continue through to find out what we would do with the remaining amount of that money. But there's a trustee group who would take advice from different organizations and, quite frankly, from deputy ministers and government.
Next, we'll go to Sharon Montgomery from the Cape Breton Post. Go ahead, Sharon.
Thank you, Tina. Hi, good afternoon. I have a question for Dr. Strang, please. In the eastern region, for the most part, confirmed COVID cases have only been increasing by one a day. We're wondering the approximate percentage of daily tests that are conducted from this region and what the low numbers of cases here are telling you.
So I don't have in front of me a breakdown of the testing numbers by health zone. We can get that for you later. The low number of cases is what I've talked about earlier. Outside of the Halifax area, we still see just sporadic cases and a local spread of COVID-19, which is good news. But I don't want people to take that as that we don't have to be as concerned about COVID-19 outside in the more rural areas of Nova Scotia or up in Cape Breton. We still know that there is significant potential for this virus to spread if we give it a foothold. And all we have to see is there's been several long-term care outbreaks in the CBRM area, and to me that's a signal of the potential for COVID-19 in anywhere across the province, and very vulnerable seniors are put at risk. So we still have to look at this from a provincial perspective, stick with our restrictive measures across the province for a few more weeks to come, and we'll continue to look carefully at the epidemiology and how we might be able to start to loosen things up, but we're not there yet.
Go ahead, Sharon, with your follow-up.
Thank you. Dr. Strang, I'm sure this question has been asked at an earlier date, but with always new information coming forward on COVID, we're wondering, is there any evidence yet of people recovering from COVID and testing positive a second time?
So it's probably too early for that. I have not heard of any of that. We certainly the understanding is that for most people with a viral infection like this, they will get some long-term immunity. How long that immunity lasts, whether it's going to be for everybody the rest of their life, or is it going to be for like influenza, where the immunity we get maybe 6 to 12 months, depending on age? We don't know that yet, and there's certainly research going on in this area.
Next, we'll go to Katie Hartai from News 95.7.
Dr. Strang, you mentioned Nova Scotia has conducted more COVID-19 tests per capita than any other province. How has that put us in a better position to fight the virus?
So testing is a critical part of the strategy, because if you don't know who's infected and who's not, then you really don't have a handle on where the virus is in communities. So broad access to testing, easy availability to testing, followed by timely follow-up by public health with people who test positive, identifying all those contacts, putting those contacts in isolation, testing them right away, and then keeping them in isolation for 14 days. That's critically important. So if you get the person who's positive, isolate their contacts, what you're doing is minimizing the chance for people who have been exposed you're stopping them from being out and about in communities, and if they do get sick, they're isolated and they're not spreading the virus to others. But that all hinges on having rapid access to testing, so people can know if we can know who's positive and not, and put all the public health measures around them. So it's critically important, and I'm extremely proud of my health system colleagues in a number of areas that I mentioned earlier, of how they've rapidly, in the last few weeks, we've gone from 200 tests a day. We have a capacity upwards of 1,500 tests a day if necessary, and as well as the ability through 811 in our assessment centers. So I think that's a key part of our strategy in Nova Scotia, that we put a lot of energy and emphasis in this, and that we need to keep that available to make sure that we have a good chance of following this virus, detecting who's sick. And again, it's important for Nova Scotians to understand if they have symptoms that may be suggestive of COVID that I've talked about earlier today, go and get tested right away.
Go ahead, Katie, with your follow-up.
Thank you, Dr. Strang. COVID-19 has been truly the worst way to experience environmental improvement, but we are seeing reduced pollution and re-emerging wildlife, as today is the 50th anniversary of Earth Day. I wanted to ask you, Premier McNeil, if there's any talk in government about seizing this opportunity to make a green recovery out of the pandemic.
Well, before the pandemic came here, we as a government continue to pass some of the most progressive environmental legislation in the country. The province is leading the way when it comes to greenhouse gases. Department of Energy has retrofits to help reduce the carbon footprint of Nova Scotians. We're seeing our energy grid be cleaned. We've seen through the Department of Forestry, we're looking along how do we do ecological forestry, ensuring that our coastlines are being protected. But let me be clear, in the midst of this pandemic, our goal is to follow the advice of public health to continue to make sure that we can control the spread of this virus and allow Nova Scotians to begin to become mobile around our province again, and allow them to the economy to continue to move forward. But I don't think anyone should lose sight of the fact of the work that Nova Scotians have been doing for decades, and I've said this before, under all three political parties, to try to lead the country in when it comes to protecting the environment.
Next, we'll go to Jana Pruden from the Globe and Mail.
Oh, hi. I'm good, actually. Thank you.
No questions?
No.
All right, thank you. That's all the time we have today. Go ahead, Premier.
Thank you, Tina, and thank all of you for joining us today. Death is all around us, and with each passing day, it doesn't get any easier. We are doing everything we can to fight COVID, but it is a vicious virus. And in the midst of that horrible disease, we have families reeling, trying to make sense of the senseless act. I want to speak about those families. They are hurting in a way that is unimaginable. I spoke to some of them today, and I want to thank them for taking my call and for being so gracious when they are feeling such loss and heartache. To be able to conjure up kindness says so much about who you are, about who you lost, and who we have lost as a province. Many people inside and outside of Nova Scotia are reaching out. They want to know they're there. They want you to know that they're there for you, and they want to help. Many are offering financial support to the families in their time of need. And I've asked the Canadian Red Cross to manage a fund so that you can make donations. You can find that information on redcross.ca. This will be known as the Stronger Together Nova Scotia Fund, and it will support immediate and long-term needs of families. Our hearts are broken, but the heart behind us is whole. A symbol of strength, and the scarf is a symbol of love and warmth. And that is who we are. While it's hard to imagine how we'll ever get through this, we will. And we will do it together, because Nova Scotia is stronger together.